So this is going to be autonomic nervous system that we're covering here, and basically what the autonomic nervous system is it is going to be motor neurons that will innervate your smooth muscle and cardiac muscle, and they will make sure that your body is everything in your body is working in unison for optimal support. Everything inside the autonomic nervous system is automatic. So when I think autonomic, I think automatic. So this is all going to be under subconscious control, and you cannot consciously change the acts of your autonomic nervous system. Just kind of looking back, so we have our central nervous system. That's going to be your brain and spinal cord. And then we'll have our peripheral nervous system. These are the nerves that are outside of the spinal cord or brain. Within there, you'll have your sensory afferent and motor efferent, so it's always the same, sensory afferent, motor efferent. Within our motor division, we have our somatic, which is conscious control, and we have our autonomic or automatic nervous system, which is our subconscious. Our autonomic nervous system is split into two major divisions, sympathetic, parasympathetic. Sympathetics fight or flight, parasympathetics rest and digest. And now we'll go into the details of how those are going to work. With your somatic and autonomic nervous systems, they're going to differ in a couple ways. First off, their effectors. Next, the pathways they go about affecting their effectors, their efferent pathways, and the neurotransmitters. And then the target organ's response to those neurotransmitters. So first off, for somatic, the only thing you have conscious control over is your skeletal muscles. So with autonomic, that's going to be your cardiac muscle, your smooth muscle, and all your glands. With your somatic nervous system, those are going to be thick, heavily myelinated motor fibers. So this is going to allow you to have very fast, smooth, calculated actions. With the autonomic nervous system, this is going to be a two-neuron chain. So you get something called a preganglionic neuron, which occurs before the ganglion, and you have a postganglionic neuron, which will occur after the ganglion. Preganglionic is usually going to be thin, and it's going to be lightly myelinated. All right, the ganglionic neuron is going to be an unmyelinated axon, and it's going to go all the way out to your effector organ, whether it's smooth muscle, cardiac muscle, or some sort of gland. Okay, next with our neurotransmitters, so we have our somatic and autonomic. Somatic nervous systems, neurotransmitters are always going to be excitatory or stimulatory, and the only neurotransmitter will be ACH, acetylcholine. With the autonomic, it matters if we're preganglionic or postganglionic fibers. Preganglionic fibers are always going to be ACH. Okay. Postganglionic fibers can be norepinephrine, which would be NEPI, or acetylcholine at the effectors. These guys can either be stimulatory or inhibitory, and it will depend on what type of tissue you are on. Okay, so here's just a picture to show us what those last few slides were. Here's a somatic. This will be your peripheral nervous system. It always uses ACH. It's always stimulatory, and it's skeletal muscle. Sympathetic, fight or flight. Parasympathetic, rest and digest. Here's our preganglionic fibers for the sympathetic. Now here's the preganglionic fibers for the parasympathetic. If you notice, they all use ACH, acetylcholine, as their neurotransmitter. Sympathetic nervous system uses mostly norepinephrine for its neurotransmitter. In some instances, it will use acetylcholine for its neurotransmitter. Its effects can be stimulatory or inhibitory. Now down at the parasympathetic nervous system, we're going to have our acetylcholine for our neurotransmitter. Now within the sympathetic parasympathetic, most all organs are going to have dual innervation. What do I mean by that? They are going to have sympathetic and parasympathetic innervation, and those two will work with and against each other to make sure that that organ is right where it needs to be. Those will be most of those negative feedback mechanisms that we're seeing. So have the body temperature go up, have the body temperature go down, have the body temperature go up and down. So those would be working with our sympathetic, parasympathetic. Now, what are the roles of the division? I said sympathetic nervous system's fight and flight. Parasympathetics rest and digest. Sympathetic nervous system is loud noise, boom, it scares you. So there's a tiger, it comes into the room and it wants to eat you. What happens? You gotta get ready to run. It doesn't matter if you're hungry, it doesn't matter if you're thirsty, or you gotta go pee. You're gonna forget about it, you're gonna go run away. So what do we need to do to run away? You're gonna increase blood flow to the skeletal muscles. You're gonna dilate your bronchioles so you can increase oxygen delivery to your tissues. You're gonna have your liver release all the glucose possible, and you're just gonna get your body to run. Parasympathetic, it's Thanksgiving Day. You had turkey, you had pie, you had all kinds of crazy appetizers, you had like 5 or 6 beers, you're sitting on the couch, half awake, pretending like you're watching football, just staring at the wall. Okay? You are relaxed, your heart rate's low, your blood pressure's low, you're not breathing very much, you're just sitting there. All the blood's going to your gut trying to soak up all this food that you ate because you ate way too much, and your pupils are going to be constricted and you're just going to be nice and relaxed. So, rest and digest, fight or flight. Okay, once again, we'll have sympathetic and parasympathetic. With your sympathetic nervous system, it's going to come out of your thoracolumbar region. Okay, you're going to have a lateral horn to your spinal cord. These guys have short preganglionic and long postganglionic fibers. Parasympathetic, you're going to have 2 spots where they come, the brain and the spinal cord. Okay, these guys have long preganglionic and short postganglionic. Here's the way the picture works. Check out your parasympathetic. These preganglionic fibers are very, very long, and the postganglionics are short. With the sympathetic nervous system, you're going to have your shorter preganglionic fibers and the long postganglionics. So here you can see all your some of your cranial nerves will fall into the parasympathetic. So we'll have 3, 7, 9, and 10. Okay, so more on our parasympathetics with their outflow. So the first one, we're going to have our oculomotor nerve. That's going to affect the ciliary. That'll go through the ciliary ganglion, and that's going to affect your eye. Next one we have here is going to be the facial nerve. That'll go through the pterygopalatine and submandibular ganglia. Those are going to affect salivary glands, nasal mucosa, and your lacrimal glands. Your glossopharyngeal nerve will go through the otic ganglion and affect your parotid salivary glands. And then your vagus nerve. This will have ganglion within the organ walls. You'll have your lungs, your heart, and most of your abdominal viscera. And the last one's S234. I remember with S234, S234 keeps it off the floor. That's your reproductive organs, your urinary bladder, and part of your large intestines. So S234 will keep it off the floor. Okay, next one. We're looking more at our sympathetic chain. So with your sympathetic chain, we're going to have preganglionic neurons in the spinal cord from T1 until L2. We're going to have sympathetic neurons that are going to be coming off the lateral horn of the spinal cord, and we're going to have preganglionic fibers passing through white rami. Alright, so we have preganglionic fibers passing through these white rami. These guys right here. These are white rami communicantes. With those white rami, they can do one of 3 things. The first thing they can do is they can go into the ganglion and they can synapse there. The next thing they can do is they can pass through that ganglion and they can go up a trunk level or down a trunk level. Or what they could do, here's our lateral horn of our spinal cord first, present from T1 to L2. Or what they can do, thirdly, they can pass straight through the ganglion off to their effector tissue, or off to their collateral ganglion. So they do not synapse in there. Okay, with your postganglionic axons, those guys are going to enter via the ventral ramus. Okay, so here's a ventral ramus of a spinal nerve. All right, here's going to be your sympathetic chain. Here's your ventral ramus, dorsal ramus, or ventral root, dorsal root. Okay, these guys are going to affect sweat glands, erector pili on hair follicles, and vascular smooth muscles. Now we're going to go through pathways. So we're going to talk about the head. We'll go through body region by body region. First off, fibers going towards the head. They're going to come from T1 through T4. They're going to synapse in the superior cervical ganglion. These guys are going to do skin and blood vessels of the head, and they will do dilator muscles of the iris. So when your iris dilates, these guys will be working with those. They'll inhibit nasal and salivary glands. So they will decrease salivation and decrease production of mucus in your nose. With the thorax, okay, so with the thorax, those preganglionic fibers merge T1 through T6, and they will go in the cervical trunk, not the superior cervical trunk, the cervical trunk. The postganglionic fibers will emerge from the middle and inferior cervical ganglion, and they will go through spinal nerves C4 through 8. These are going to be the primary fibers for the heart, the thyroid gland, and the lungs. Now with our collateral synapses, these are going to be fibers from T5 to L2. They're going to synapse in the collateral ganglion, and these are going to help form our thoracic, lumbar, and sacral splanchnic nerves. These ganglion will be the celiac, superior mesenteric, and inferior mesenteric ganglia. When we get into the blood vessel chapter, you'll notice that the superior and inferior mesenteric ganglia go right along with the superior and inferior mesenteric trunks, which are going to be blood vessels. Okay, with the abdomen, we're going to have preganglionic fibers from T5 to L2, and they're going to go through our splanchnic plexus, or our splanchnic nerves. The synapses will occur in the celiac and superior mesenteric ganglia. Postganglionic fibers are going to serve our stomach, right here, our small intestines, large intestines, liver, and the spleen. Sorry, and the kidneys. Okay, with the pelvis, you're going to have preganglionic fibers from T10 to L2, and those guys are going to go through the lumbar and sacral splanchnic nerves. Their synapses will occur in the inferior mesenteric and the hypogastric ganglia. The postganglionic fibers are going to be doing the distal half of the large intestines, the urinary bladder, and the reproductive organs. So with the medulla, with the adrenal medulla, the adrenal medulla is going to be making epinephrine, norepinephrine. So the fibers inside the adrenal medulla that will be making that epinephrine and norepinephrine are called modified preganglionic sympathetic fibers. All right, modified preganglionic sympathetic fibers. So what those guys are going to be doing is they will be making norepinephrine. So why is it important that they're sympathetic fibers? Let me scooch ahead here. Because if you look at this side, slide, you'll see that our sympathetic fibers are going to be making our norepinephrine. Okay? When we go back here, we say that upon stimulation, medullary cells are going to be making norepinephrine and epinephrine. Okay, so the cells are, did I say they were preganglionic? The cells that are going to be making the epinephrine and norepinephrine are actually postganglionic fibers. So they'll be modified postganglionic sympathetic fibers that are making the epinephrine and norepinephrine. Some of them will pass right through without synapsing, and then they'll go on and they'll be making epinephrine, norepinephrine in other places. Okay, so with your organs, those guys are going to have reflexes, very similar to your spinal or somatic reflexes. They're going to have a very similar arc. It'll have a couple differences, and the big thing is that there's going to be two motor neurons, or two neurons within the motor pathway. So first off, you'll have a receptor. Next, we'll have a sensory neuron that will carry the information into the lateral horn of the spinal cord, which will be your integration center. Within that integration center, you can have a preganglionic neuron, you can have an interneuron within the lateral horn, or this can actually occur within the wall of the GI tract. Next, you're going to have an efferent pathway, and it'll be a two-neuron chain. You'll have a preganglionic neuron, and then you'll have your ganglionic neuron. And that ganglionic neuron will travel out to your effector neuron, or effector organ, and you will have your desired response. Okay, next one we have our referred pains. So with your referred pain, you get your visceral type of pain. The gist of it is that your pain, your visceral pain is going to travel along the same pathways as somatic fibers. So organs will have pain that is not in the organ itself. It will refer to a different part of your body. For example, the one most people know is your heart. Typically gives you pain in your left arm. It can be in your armpit, or it can travel all the way down your legs. Another one that I see a lot of being a chiropractor is I'll see people with ovarian pain or appendix pain or kidney type of pain, and it presents as low back pain. And I need to rule that out on a patient to make sure that we're not missing something else. But this picture kind of just shows you where some pain referral patterns go. So the neurotransmitters, we're going to have two major types. We'll have our acetylcholine, which are cholinergic, and we'll have our norepinephrine, which is adrenergic. Acetylcholine will be for all preganglionic axons, and it will be for all postganglionic parasympathetic axons. Norepinephrine is going to be for the postganglionic sympathetic axons. So norepinephrine, postganglionic, sympathetics. Acetylcholine, pretty much everything else. So once again, we're going to see here, acetylcholine's all the preganglionics. You see all these guys are preganglionics. They're all using acetylcholine. Postganglionic sympathetic uses mostly norepinephrine. There are a couple exceptions. So when you go to sweat glands and blood and some blood vessels within skeletal muscles, they can use acetylcholine. And our parasympathetic, their postganglionic fibers will be using acetylcholine once again. Okay, with the receptors, we're going to have some different types. We'll have cholinergic receptors and adrenergic receptors. Cholinergic receptors will use or respond to acetylcholine. Adrenergic receptors will respond to norepinephrine. Within the cholinergic receptors, there's two types: nicotinic and muscarinic. With nicotinic receptors, these are going to be really, really common in skeletal muscles. When I think of nicotinic receptors, I'm usually thinking skeletal muscles. All right. Other spots you're going to find them are going to be ganglionic neurons with sympathetics and parasympathetics. Those will be on the ganglion itself. Hormone-producing cells within the adrenal medulla, and these guys will always have stimulatory effects. With muscarinic, you'll find these on postganglionic cells, and our adrenergic receptors with our epinephrine, norepinephrine. We have a chart talking about these guys. We'll go into them on here. So with acetylcholine, like we said, nicotinic or muscarinic. Nicotinic's usually going to be excitation. With muscarinic, it's going to be excitation in most cases. With cardiac muscle, it will be more inhibitory in nature. With our norepinephrine, we'll have different type of receptors. So there's beta 1, beta 2, beta 3, alpha 1, and alpha 2. There will be specific medicines that can block any one of these receptors, and when you block these receptors, you're going to have an opposite response to whatever's happening here. So with beta 1 receptors, these can affect the heart and kidneys. With beta 2s, these guys are going to affect the lungs and pretty much most other sympathetic targets. Alright, and they'll be real common on blood vessels, serving the heart, liver, and skeletal muscle. Beta 3, these will be active on adipose tissue. With alpha 1 receptors, these will be present with blood vessels to the skin, mucous membranes, abdominal viscera, kidneys, and salivary glands. And then with our alpha 2, these guys will be with our pancreas and blood platelets. Okay, so we'll have some drugs. So with atropine, this will be an anticholinergic block. It will block muscarinic receptors. So what this will do is it'll prevent salivation during surgery, and it'll dilate the pupils for examination. So if we look at muscarinic, all right, and we said sweat glands and we say blood vessels, so one of the other things that's going to be affecting here is salivary glands. We block those receptors, you won't be able to salivate. With over-the-counter drugs for colds and allergies, all right, those guys will be alpha adrenergic receptors, so we can cover those up and stop their production. With beta blockers, such as beta 2s, those guys can help dilate the bronchioles and lungs, or they can help with decreasing blood pressure by decreasing heart rate. So here are all these different drugs classes, an example of the drug and how it's used clinically. So for example, acetylcholinesterase inhibitors, what these guys do is they stop the breakdown of acetylcholine. All right. And what these guys will do is help out with somebody with like myasthenia gravis, where they're not having proper talking between their nerves and their muscles. Okay, with the interaction within the autonomic divisions, most organs will have dual interaction. There will be a sympathetic component and a parasympathetic. Sympathetic will prep it for fight or flight. Parasympathetic will make it ready for rest and digest. So sympathetic is going to be mostly heart and respiratory rates will increase, and it will stop digestion. Parasympathetic will decrease your heart and respiratory rates, and it will start digestion, and it will help your body discard waste, and it will be time for healing also. With sympathetic tone, this is very important. This is always going to keep your blood vessels in a constant state of contraction to maintain blood pressure. Sympathetic tone, parasympathetic tone. Sympathetic tone, sympathetic fibers will fire more rapidly to constrict blood vessels and cause an increased blood pressure. Sympathetic fibers fire less rapidly to dilate blood vessels and drop your blood pressure. If you have alpha blockers, those are going to interfere with your vasomotor fibers, and those are going to cause vasodilation and drop your blood pressure. With your parasympathetic, think rest and digest. So heart, smooth muscle, and your digestive tract. It'll decrease your heart rate, it'll increase digestive activity, and it'll let you absorb all the nutrients from your gut. Sympathetic nervous system can always override this during a time of stress. So if you're really upset or stressed out about something, you ever noticed you're not very hungry? So that's where they're looking with there. Okay, once again, there's cooperative effects. The easiest one to see with the cooperative effects is with the external genitalia. Parasympathetic fibers will cause vasodilation, and it will cause an erection of the penis or the clitoris. And sympathetic fibers will cause ejaculation of semen in males and contraction of a female's vagina for orgasm. I remember it as point and shoot. Parasympathetic causes an erection. Sympathetic will cause the ejaculation. Parasympathetic is going to be the vasodilator. Sympathetic is going to be the contraction for the females. So there's going to be some unique roles that just the sympathetic nervous system is going to do. The adrenal medulla, sweat glands, erector pili, the kidneys, and most blood vessels will only receive sympathetic input. Next ones, we're going to have our thermoregulatory centers, and those will respond to heat. The renin-angiotensin mechanism, which we really don't talk about much until we get further into the into AMP2, but that mechanism is only affected by the sympathetic division. And then metabolic effects. So if you want to increase the metabolic rate of cells or increase your glucose levels or mobilize fat, these guys are all under sympathetic control. With localized versus diffuse effects, parasympathetic are going to have short-lived, highly localized controls. Sympathetic will have longer-lasting body-wide effects. Kind of like if somebody cuts you off and they make you really mad and your heart rate spikes up, you don't calm down immediately. It takes a minute or two before you relax from that. And finally, with the controls of the autonomic nervous system, most of the influence is going to be from the brainstem. Moving up a little bit, you can have your hypothalamus. That'll be the big integrative center for the autonomic nervous system. You're going to have some subconscious control in your cerebrum, and that'll be coming via your limbic system. And those go right back down with our hypothalamic function. Then other controls, you can have cerebral cortex and your reticular formation. That's it.